Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about fixation, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. I will discuss rationale and aims, learning outcomes, indicative content, resources, submission of evidence, Q&A suggestions, some evidence ideas, reflective statement, and some helpful tips to make your portfolio better. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into this submodule. Rationale and aims of this submodule outline the general information and expected knowledge and competence that needs to be achieved when this submodule is completed. These are relevant to each submodule. For the fixation submodule, the expectations are that the candidate will have understanding of the changes cells and tissues undergo when they are removed from the will have understanding of tissue stabilization via fixation and how different approaches can be employed to ensure optimal sample preservation. Will be able to explain and demonstrate processes employed during tissue fixation and how they can impact subsequent analysis of samples. Will be able to safely select, prepare and apply rangation techniques and reagents to samples received in the laboratory. Will have clear understanding of the impact of fixatives on the tissue, diagnosis, and patient management. The learning outcomes demonstrate candidates' knowledge, skills, and competence in this submodule. They also include demonstration of the understanding of scientific principles, laboratory procedures, quality assurance, and professional conduct. They allow candidate to work autonomously and solve problems independently. Let's explore the first learning outcome, which is for the candidate to describe the changes that cells and tissues undergo when they are removed from the body. What are those changes? What is happening to cells and tissues when they are removed from the body? Consider agonal changes of PM and surgical tissue, hypostatic congestion, coagulation, cap expansion, edema or dehydration, anoxia, autolysis, putrefaction, liquefaction, gas formation, vacuolation, cell swelling, enzyme release, rigor mortis, loss of homeostasis, loss of ADP, ionic imbalance, metabolic reactions, nutrients and oxygen intake by cells. How can you link all this to fixation? The second learning outcome is for the candidate to explain the risks associated with the handling of fresh cellular pathology samples, including tissues and fluids, and discuss how these are managed in a laboratory environment. What are the risks associated with handling unfixed tissue? What PPE and safety hoods are available to you? Consider details and risks like infection, use of sharps on unfixed samples, physical hazards like sharps injury or cold-induced injuries during cryopreservation, aerosol generation, chemical exposure during tissue fixation or preparation, area contamination where the sample is being processed, spillage risks when working with fluids and so on. Also consider risk-reducing actions like containment, vaccination, use of PPE, risk assessment, SOPs, training, ventilation, waste management, and so on. How would you personally deal with unfixed sample? The third learning outcome is for the candidate to describe situations when it may be necessary to delay fixation and discuss the challenges this presents and how these can be overcome. Why would we delay tissue fixation? What circumstance would require delayed fixation? Consider logistics, frozen section, genetic analysis, pathogen preservation, biobanking, specimen type or size, for example huge cysts. What challenges can arise due to delayed fixation? Consider delayed fixation and cellular degradation, quality of staining, preservation of proteins and genetic material, infection risks, contamination, spillage risk, delays in diagnosis and treatment, and so on. How would you overcome these challenges? Consider risk assessment, use of PPE, training, SOPs, containment, vaccination, ventilation, and so on. The fourth learning outcome is for the candidate to describe the properties and modes of action of different fixatives used in cellular pathology, e.g. cross-linking, precipitation, oxidation, and discuss their advantages and disadvantages and the samples on which they are used. What fixatives can be used in histology? What are their properties? What is their mode of action? Consider cross-linking fixatives like formalin or glutaraldehyde, precipitating fixatives like alcohols or acetone, oxidizing fixatives like osmium tetroxide, their mode of action, properties, their advantages and disadvantages, sample types they are used for. You could consider compound fixatives like Buon's or Zenker's fixatives and their properties. The fifth learning outcome is for the candidate to identify practical considerations required when fixing tissues, e.g. penetration rates in differing tissue types, and discuss how these can be overcome. What practical consideration have to be taken into account when fixing tissue? Consider temperature, volume ratio, concentration, speed of action, tissue size and type, ischemic time, depletion of fixative type used, diffusion and penetration rate, additives present in the fixative or pH. How could they be overcome? Consider choosing the right fixative, immediate fixation, appropriate duration of fixation, ratio of 20, sample opening or slicing to allow fixative penetration, room temperature, gentle agitation, use of buffers and so on. The sixth learning outcome is for the candidate to discuss with examples the impact of fixation on IHC staining patterns. What impact does fixation have on IHC staining? Consider antigen diffusion, antigen masking, morphological damage, delayed fixation and antigen loss, overfixation and false negative staining, weak or lost signal due to underfixation, background staining or inconsistent staining intensity, impact on antigen retrieval and so on. How would you overcome those? Consider specific example like HER2, ER, PR, Ki67 or lymphoid markers that can be significantly affected by fixation. The seventh learning outcome is for the candidate to demonstrate monitoring of hazards associated with fixation and explain why these are necessary. What hazards are associated with fixation? How can those hazards be monitored? Why is it necessary to monitor those hazards? Consider different types of fixatives, their exposure limits, monitoring of exposure, health hazards, safety hazards, environmental hazards and biological hazards associated with fixation, risk assessments, and health and safety audits, ventilation and so on. Also consider why they are necessary like employee safety, patient safety, or public safety. The eighth learning outcome is for the candidate to explain why it is important for samples to be optimally preserved and discuss the impact deterioration can have on patient outcomes, management. Why is it important to optimally fix specimens? What could happen if samples were not properly fixed? How can poor fixation affect patient outcome management? Consider over and under fixation, structural damage, cellular degradation, compromised sample analysis, artifacts, weak or inaccurate staining, misinterpretation, unreportable sample, misdiagnosis, digital pathology and AI algorithms, patient safety, delays, costs, resources and so on. The ninth learning outcome is for the candidate to discuss common technical issues which may arise during fixation including their root cause, and how these may be overcome without compromising sample integrity. What are the common issues arising during fixation? How can they be overcome? Consider under and overfixation, delayed fixation, fixation pigments, or distortion of architecture, use of wrong fixative and so on. Also consider steps during troubleshooting like problem identification, corrective and preventive actions, communication and record keeping. Indicative content highlights knowledge and understanding requirements that might be assessed during the viva. They may or may not be demonstrated by the learning outcomes or candidate's evidence. In the fixation submodule, candidate is expected to have knowledge and understanding relevant to changes samples undergo when they are removed from the body and how to be minimized. What changes does the tissue undergo when removed from the body? How can these changes be minimized? Consider autolysis, putrefaction, anoxia, lack of nutrients, livor mortis, cooling, cell transfer media, freezing, fixation. Relevant to situations where delayed fixation is required and the importance of this. Why would tissue fixation be delayed? What circumstance would require delayed fixation? Consider logistics, frozen section, genetic analysis, antigen preservation, biobanking, specimen size. Relevant to different fixation techniques and how these can be applied to tissue samples. What fixation techniques can be used? Consider heat, immersion, perfusion, microwave, freezing, vapor. Relevant to different fixation reagents, how they differ and how they can be applied to a variety of tissue samples. What fixation reagents can be used in histology? How do they differ? When are they applied? Consider common fixatives like aldehydes, alcohols, specialist fixatives, buffering, pH, temperature, penetration rate, speed of fixation, diffusion rate, artifacts. Relevant to the methods to improve penetration time. What methods can improve penetration time? Fixative. Consider slicing, heat, agitation, pressure, vacuum, sample size. Relevant to the health and safety considerations that apply to fixation. Consider COSHH, risk assessments, environmental monitoring, safety data sheets of reagents, PPE. Relevant to the impacts of preservation on patient management and outcomes. Consider interpretive and diagnostic issues, treatment recommendations, subsequent analysis, genetic preservation, antigen preservation. Indicative content also highlights skills the candidate is expected to be able to do. Candidate must be able to prepare, safely handle, safely use, safely dispose range of fixatives commonly available within histology department. Resources section on the Brightspace contains some very useful information. Submission of evidence on Brightspace informs the candidate what evidence needs to be submitted for each subsection. Candidate needs to submit answers to questions that were set by the training officer. I will share some examples of possible questions later on. Candidate also needs to select an additional piece of evidence relevant to this subsection. I will also share with you some ideas of possible evidence later on in this video. Each submodule requires the candidate to submit their reflective statement relevant to their practice and training in each submodule. Questions should be set by the training officer. They need to be based around the knowledge requirements, relevant for each subsection. They should allow the candidate to demonstrate their understanding in each subsection. The questions should be specific and relevant to the candidate's in-house practice. They should also allow the candidate to demonstrate their specialist knowledge. If you would like to see specific example questions, please have a look at the fixation video for trainers. Link will be included in the video description. These are some ideas you could explore for your chosen piece of evidence. And some more ideas for your chosen piece of evidence. And some more ideas for your chosen piece of evidence. Each submodule also contains reflective statement which is asking you, the candidate, to summarize your role in the laboratory in the context with each submodule. How do you demonstrate that you can draw a conclusion from what you have learned, reflect on your current practice and how it can change in the future due to gained knowledge? Think about what is your laboratory in context this submodule. What impacts can your actions have on your colleagues, department as a whole and for the patients? You also need to write a personal reflection on your training and why you chose your evidence. This is very personal to your own circumstance. It should demonstrate your ability to be self-aware when analyzing the gaps in knowledge. You can use it as an opportunity to reflect on aspects of your training, application of your gained knowledge and skills, and how you have achieved your goals. Think about what your evidence demonstrates. Why did you choose this specific evidence for this submodule? Also write what your training was like when it comes to this submodule and how your practice changed due to your training. The reflective statements can also be used as a CPD evidence in case you are chosen to be audited by the HCPC. I would also like to share with you some helpful tips that can make your portfolio look really good. Try to present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs or even videos, if you can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Try to make it a little bit more interesting to the reader, which will be your training officer and eventually the assessor. Try to put yourself in their shoes. How would you like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture is worth 1,000 words. I will make a video. I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also try to use various types of evidence, not just one type, like case studies, for each submodule. You could use experiments, case studies, annotated results, annotated photographs of you performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation and verification evidence, comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Try to bring in your personality. Think about the ways you like to learn best. If you like experimenting, perform experiment. If you like troubleshooting, perform troubleshooting. Choose something that demonstrates your understanding, knowledge, skills, and how you apply this in your practice. And one more thing, keep the learning outcomes in mind when you selecting your evidence. Good evidence will tick off several learning outcomes. And this brings me to the end of today's video. Hopefully you now have a better understanding about the learning outcomes for this submodule. And I hope you also have a better idea what evidence you can choose to demonstrate your competence. And my final take-home message? Keep those learning outcomes in mind when answering questions and selecting your evidence. Bye for now.